First and foremost, welcome to the Beyond the Birth Story podcast. I am elated to have you in my space today.
Thanks for having me. I'm so excited to be here.
Of course. As always, I'm going to allow you to introduce yourself. So, whatever you're comfortable sharing, and we'll go from there.
I am Dr. Sara Reardon. I am a board certified pelvic floor physical therapist, and I've been practicing for over 18 years. I treat all genders, but mainly focus on helping women with pelvic floor issues at every stage of life. And that can include addressing things like urinary leakage, pelvic organ prolapse, childbirth recovery, peri-menopausal and menopausal changes, painful sex, really anything related to your pelvic floor. And I have an Instagram account called the Vagina Whisperer, which has, really grown over the past several years. And I think that the growth is really a testament to how many women and people really want this pelvic floor education and information, and they're just not getting it from our traditional healthcare system. So I'm really all about helping people better understand their bodies and get pelvic floor care. And most recently, I have a book that is coming out on June 10th. So, depending on when you listen to this, called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, that I'm very excited about.
Ugh, I'm so excited. It's a vibe too. Like the book's pink. It's like so fun. I am here for it.
Thank you. There's juicy fruit on the front. So it's and I think that, some of the feedback I've gotten about kind of my account and the book is just like talking about this part of our body, the pelvic floor, the vagina, the vulva, and just really kind of open, accessible ways that aren't scary, that aren't overly medical, and just really helping women better understand their bodies and just in a way that we haven't ever really been taught before. So it's really something I'm super passionate about.
I love it. Yeah, just normalizing the conversation, right? We all have one.
Right.
And there's so many things out there, like social media or on the shelves in the store. Like, what are we using? What are we not? Like, what's the right approach? And, we get sucked into all these different things. So it's like, let's start there. How are we taking care of it? All of that.
I know. So I think it might be helpful just to even to explain what the pelvic floor is, because I think a lot of people don't even know what it is and what it does and how to take care of it. So your pelvic floor is a group of muscles that sit at the bottom of your pelvis. So you can kind of imagine or envision those bones of your pelvis that we see on skeleton models. And at the very bottom is an opening. Well, that opening actually in your body is kind of covered with a hammock of muscles, and they sit like a basket or a hammock, and they attach from the pubic bone in the front to the tailbone in the back and side to side. And inside of that hammock of muscles is your uterus, your ovaries, your bladder, which holds urine, your bowels, which hold stool. And in female bodies, that muscle also has three openings: one for the urethra, where urine exits, one for the anal opening, where poop exits, and then the vaginal opening for vaginal birth, menstruation, and vaginal intercourse. So these muscles are working for us all throughout the day, when we breathe, when we move, when we pee and poop and, laugh and all of the things. But unfortunately, we don't often realize they exist or that we even have a problem with pelvic floor muscles until we start experiencing something like leakage or painful sex or tailbone pain or things like that. So what I cover a lot in my book is really like, how do we care for this part of our body? How do we help prevent issues? What's normal, what's not? And then if you are experiencing pelvic floor issues, like some tips and exercises to start working on those problems right now.
I love that. Yeah, it's like this foreign concept. I mean, we talk about Kegels and we talk about all of these things, but it's like, what are those even?
Right. And, Kegels are pelvic floor muscle contractions, like you're closing the urinary and anal sphincter, like you're lifting that basket or kind of trampoline of muscles up. But Kegels are just kind of one piece of pelvic floor training. A lot of people actually shouldn't be doing Kegels because they have tension in their pelvic floor already. So Kegels are great for strengthening, but if you have tension or incoordination and you're doing Kegels, it could actually make your problem worse. So, what I think is really important, and one of the first things I cover in the book, is like, which pathway should you walk down? Do you need strengthening or do you need lengthening and relaxation to really help guide women on how to care for this part of their body versus just like do your Kegels, which has been the narrative that we've been told for so long when anything about our pelvic floor comes up.
Is like, how should we kind of go about this pre-childbirth, during pregnancy and then after pregnancy and birth,
You
I
know,
guess.
yeah, and I love chatting about this with respect to pregnancy and childbirth because not you can have pelvic floor issues even if you have never been pregnant, even if you've never given birth, because your pelvic floor goes through changes at every season of life when you're menstruating, when you become sexually active, when you exercise. But being pregnant and giving birth are two big risk factors for pelvic floor dysfunction. And that's because during pregnancy, this hammock of muscles is supporting your uterus, which has a growing baby. And we get a lot of these text messages, or emails during pregnancy, like your baby's the size of an avocado, then it's the size of a papaya, then it's the size of a watermelon. Well, if
Hmm.
you think about a hammock holding an avocado or a papaya, it's not going to sink that much lower. It's not going to change that much. But if you think about a hammock holding a watermelon, it's going to sink low, it's going to get stretched out, it's going to get weaker. And that's what happens to your pelvic floor during pregnancy. So, regardless of what type of birth you have, your pelvic floor changes just from being pregnant. And then, depending on what type of birth you have, either a cesarean birth, which changes your abdominal wall and can affect your pelvic floor, and then also a vaginal birth, which can lead to weakness or prolapse or scar tissue from vaginal and perineal changes. That also kind of is another risk factor for pelvic floor changes. So, I think what I really love is helping women proactively when they're trying to conceive to kind of start engaging with their pelvic floor, knowing if it's tense or weak, how to start strengthening it proactively. And then during pregnancy, strengthening your pelvic floor for the first and second trimesters, but then really working on relaxation and lengthening and bulging because we want your pelvic floor muscles to be relaxed for a vaginal birth. We don't need super strong, tight ones. We need kind of
Hmm.
coordinated ones for a vaginal birth. And then postpartum, we go back into like rebuilding your pelvic floor and core postpartum to help really give you that core strength that has been changed and compromised from pregnancy and birth.
Hmm. So in terms of, because like it's interesting about the C-section, and I think before I used to think, oh well, I didn't push a baby out, so maybe I'll get lucky. So how does that differ between the vaginal birth and the C-section? You said the abdominal wall.
Right.
Hmm.
So the research is showing that women or, birthing folks who have a vaginal birth are at a higher risk of developing urinary incontinence and which is leakage and then pelvic organ prolapse. And the reason for that is because your pelvic floor stretches up to 3 times its normal length for a vaginal birth, for a baby's head to come down the birth canal, stretch the vaginal walls, and come out through the introitus or vaginal opening. And over 90% of birthing folks have a perineal tear, which is often into the muscle of the pelvic floor. So just those two changes itself kind of compromise pelvic floor strength and function after giving birth. For a C-section, you were cutting through 7 layers of muscle and tissue and organs to get to baby. And scar tissue doesn't heal and move the same way that pre-surgery tissue does. So like often you'll see moms who have like a cesarean shelf or their
Hmm.
scars painful, numb, sensitive, or even stuck. It feels like it's kind of stuck down. And so when you have that like decreased mobility of tissue, it can lead to tension or pain or kind of compromised muscle function. And those tissues of the abdomen connect with your pelvic floor. So what we see in C-section moms is painful menstruation, difficulty starting their urine stream, constipation, and painful intercourse. Things that are kind of associated with like tension or restriction we see in cesarean birth moms. So it's different and it requires a different type of treatment afterwards, but it's also very connected to your pelvic floor. And really, C-section moms 100% need to go to pelvic floor therapy because they've gone through major surgery and there's not any rehab afterwards.
Hmm. Yeah, I noticed that with mine specifically. I have such a thick, like, layer of scar tissue, and I you can tell by the density of the difference and the shelf. It's just like, is this gonna stick around forever?
Right. And so one of the things we work on in pelvic floor therapy is kind of starting to massage the scar
Hmm.
above and below it, teaching you how to do this. I think a lot of what can happen, oftentimes cesarean births are emergent or sometimes even traumatic for folks. And so they
Yeah.
don't touch the scar. They don't work on it. It's scary to even kind of one look at, touch, but especially massage. And so
Mhm.
we really work with folks to kind of get those tissue moving. We do dry needling to it. We do cupping to it. We kind of do mobility and sensation work and really soften those tissues so they can move better and more freely,
Mhm.
and you can have less discomfort and pain.
Yeah, especially that pulling feeling if I you stretch the certain way and you feel ugh, it's just such a weird feeling. I can't even describe it unless
But I think
you've
you're
had it.
describing what a lot of moms feel, and you feel like,
Yeah.
okay, do I just like, what do I do about this? You
Yeah.
know?
Is
And so
this
it can
just because I had
feel,
a C-section? Like
yeah, and it can feel really scary to like what's safe and what's not, and am I going to harm
Mhm.
it? And so it's actually, if your scar's fully healed, you can totally work on it. And I tell this story in my book that I was working with a mom who was probably in her early 60s. She had 3 kids who she had had all via cesarean section, and she also had an abdominal hysterectomy. So kind of back in her day, they were doing hysterectomies through the abdominal wall. So she had 4 abdominal surgeries and never had any rehab, and she was having chronic urinary tract infections because her bladder wasn't emptying well. And when I worked with her, they thought it was like a pelvic floor issue. But when I worked with her, I actually started working on her C-section scars from decades previously. I mean, these were
Mhm.
30-year-old scars. And just working on her C-section scars helped her better empty her bladder. And we didn't even do internal work. It was just
Mhm.
external. And it was like those scars had gotten so tight and restricted. It was preventing her bladder from emptying fully, and just releasing the tissues helped her. And that was leading to UTIs decades later. So,
Oh, yeah.
it's never too late is the story, and you can always work on it to be proactive to take care of this part of your body.
Mhm. In terms of prolapse, how can we so I had a listener message about a symptomatic prolapse post-delivery. What can we do for that in terms of, the pelvic floor
Yeah.
lens?
So, prolapse is when your pelvic organs aren't as well supported by that basket of muscles.
Mhm.
And when that basket of muscles gets weak or lengthened or even tired, the organs, your uterus or bladder or rectum, kind of start to push into the vaginal walls. So you can feel a bulge at the vaginal opening, pressure or heaviness in the vagina. It can feel like something's falling out or even like tissues rubbing against it. So the first thing you have to do is like look at what you're doing during the day. Are you straining? Straining with bowel movements, straining with weightlifting, lifting kids or heavy objects multiple times a day, and holding your breath, which puts more pressure on your pelvic floor. You also need to lift, get support. So there's some like external underwear you can wear that kind of like, it feels like it's like a hand is like holding up your vulva. It gives you a little bit
Mm.
of external
Mhm.
support. Or there's even internal supports like a pessary or even just using a tampon to kind of support the vaginal walls. And that kind of just gives those tired tissues a break. However, you can't insert anything into the vagina until you're 6 weeks postpartum.
Mhm.
So, in that first 6 weeks, it's recommended to not put anything in the vagina. But if you're post 6 weeks postpartum, then you can start using internal supports. And that just kind of gives your tissues a rest. And
Mhm.
then I would start either relaxation of the pelvic floor muscles if they're tight or tense, and then strengthening to help give those muscles more tone and support. Working on longer hold pelvic floor contractions because the endurance portion of the muscle is really what's helped support prolapse. So
Mhm.
there's a lot that you can do kind of before you go onto a surgical procedure or things like that to give you comfort. But you do need to train and exercise your pelvic floor muscles in addition to not straining and getting internal or external support.
Mhm. And I think it's important to note too, would you recommend an actual assessment
Oh,
before,
yes.
yeah, going for something like this? Because I know sometimes in socials we can say, "Oh, well, it's working for this woman or whatever," and it's like, well, is that what you need? Especially when you get into the tightness versus relaxation,
Right. And,
right?
one of the things that a lot of what I cover in the book, it's just the basics of how you should be doing things. Like
Mhm.
when you pee, you should sit down and not hover. You should, relax, don't push when you pee, things like that. When you're pooping, like support your perineum, kind of hold up your vulva and vagina when you're bearing down to poop so that you can get some support for the prolapse, making sure you're keeping your poop soft. Put your feet on a stool so that you're in a more relaxed position for your pelvic floor muscles. When you're lifting, like exhaling. So this is like lifting weights, but also like lifting your baby, lifting a stroller. Don't hold
Mhm.
your breath. So those are the types of educational tips you can get from the book or social media where it's like those are universal. But I think determining which path you walk down, nothing beats seeing a pelvic floor therapist in person, 100%. However, I think a lot of people have difficulty accessing them.
Mhm.
There can be wait lists. There can just not be one in your area. They can be costly. You may not have childcare or work coverage. So I think we just want to start somewhere. And, the great thing about the medical system is we have options now. You can do telehealth. You can do online programs. You can read my book. You can, do in-person therapy. So we've got different starting points for everyone depending on what their level of accessibility is.
Mhm. You said something about a tampon for internal supports. And so this is going to lead me to a different topic, similar, but for menstrual cycles. So the discs are really big right now. The cups are really big. What is your kind of standpoint on that versus your classic tampon?
This is another area where I feel like was so ripe for innovation, and I'm really glad that we have options now.
Yeah.
So, in order to insert something into the vaginal canal, the muscles have to be relaxed, and you have to have actually enough tone in the muscles to actually keep the insert in. So, a common complaint for women postpartum is that like my tampon's not staying in because their walls are weak. Their pelvic floor and vaginal walls are weak. And so that's a sign of needing some pelvic floor training and strengthening. The same thing for a cup or a disc. I often find that people who have prolapse do really well with a disc because it sits a little bit higher
Hmm.
in the pelvic floor, almost like a little bowl or a plate, and just kind of holds everything up. Um, but cups are another great option. They sit around the cervix and they work with suction. I would say people who have, you kind of have to try a disc or a cup to see which one works for you. But if you have an IUD, there is some research that having a menstrual cup can lead to a higher risk of dislodging the IUD because of the string. And then also when you remove a menstrual cup, it works with suction. So you don't want to tug on it. People are
Hmm.
always like, will a menstrual cup cause prolapse? And I'm like, not if you use it properly. To remove a menstrual cup, you have to release the suction and then remove it. So it's important to kind of just know how to use these things properly to get the most out of them. And then I love period underwear. Like I'm such a huge fan of,
Hmm.
wearing them at nighttime, wearing them during the day. I think they give so many options versus wearing like a bulkier pad if you don't want to insert something
Hmm.
internally. So I just am so thrilled we have options now and it's like an algorithm every month for my period. I'm like, what do I use this day versus this day?
Literally. I love options. I recently just started because I always joke like off the movie Mean Girls, wide set vagina, heavy flow, but I'm like I always was leaking, no matter what, no matter what. And I'm like, okay, so now I'm wearing a tampon or a cup plus a pad. I'm like, this is so
Right.
cute, and
Yeah.
so yeah, invested in those underwear, 10 out of 10.
10 out of 10. I mean, I
Yeah,
wear them at
even spotting
nighttime. I
days.
wear them with
Yeah,
traveling. It's a game changer. And I just feel
yes,
really grateful that again, and a
yeah,
lot of young girls actually like them because
yeah.
like you don't have to wear a big bulky pad. You can wear them under like if you do dance or cheer or wear leggings and they're not so visible and it can be backup if you do use, even a pad or a tampon. So it just gives I think a lot more flexibility in our lives to
Hmm.
have these options.
Yeah, the tampons personally scare me. I feel like I always just get so irritated.
Yes. Yeah. And dry tampons are not friends with your vulva. I mean, and vagina.
No.
So I hear that. I totally
Mhm.
hear that.
I'm just thinking back to a time, this is gonna be super embarrassing, maybe TMI, but I was younger wearing a cup and did not know to release the suction. And I was at work and just like pulled it. Anyways,
I know. And it's
a
scary.
mess.
I mean, I actually tell people to do it in the shower, to remove it in the shower because you
Yeah.
get down
Okay.
to the squatting position, like getting down into a deep squat
Yeah.
or what I call like Captain's Morgan position where you like put one foot up on the edge of the
Yep.
tub or something. And then that like opens up your pelvic outlet. And then
Mhm.
you can reach up to get the cup and then you squeeze it and then remove it. And then you can rinse everything out. And it just feels like there's not like this crime scene in your bathroom.
100%. That I think has been the most common theme of like intimidation when I recommend a cup to somebody. They're like, "Oh my gosh, how do you even get it out and in?" I'm like, "I don't know, you just do."
Yeah, like a bunch of fingers, and yeah, you got to get in there for sure.
Yeah, get comfy. I had a good friend the other day. She was like, "Oh my God, I seen that you're having the Vagina Whisperer on and I have questions." I was like, "Okay." And she's playing like, "Why does my vagina smell so bad postpartum?"
Oh, hormones, girl. It is all hormones. Like you actually have, it's very normal. Your whole body smells postpartum. So,
Literally.
literally. So, I would say first, if you do have an odor, you always need to rule out infection because you can
Mhm.
have an infected wound, you can have a vaginal infection, bacterial infection, a UTI, a yeast infection. So, like, always go get it checked. Like, odor is not normal from the vulva and vagina. Like there's always a scent, but like a strong odor that you can smell. So go get it checked. I've had patients who have like had wound infections in their perineal tears. And I'm like, okay,
Oh.
you got to get this checked out.
Mhm.
If it's not an infection, it's really your hormones. I mean, you are dropping estrogen, and your vulva and vagina have a lot of estrogen receptors. So after you give birth, your estrogen levels just plummet. And that's why you get these like shakes and shivers and night sweats like those first couple days after giving birth. And the reason your estrogen plummets is because you need low estrogen to have high prolactin. And prolactin is the hormone that produces breast milk. So as long as you're breastfeeding or lactating, you've got low estrogen to have high prolactin. That's why your period doesn't come back for a bit. That's why you may have vaginal dryness or pain with sex and things like that, is because of those low estrogen levels. And when you don't have that, you don't have that kind of same lubrication and fluid makeup and pH balance in the vulva and vagina because of just those
Mhm.
hormonal changes. So it's pretty normal. It does totally get better. I would say month 1 is the worst. By month 3, you should be feeling pretty normal. But again, any kind of prolonged like foul smell, you should get checked out for sure.
What is considered like I know over the years it was like you never want to scent at all. You want to smell like flowers and you buy this wash and that wash. What is considered like a normal smell? Does
Not
that make sense?
flowers.
Not flowers. Okay.
I mean, it's normal. It's like mild. I can't even explain it.
Oh.
It shouldn't be really smelly, but it's got a light scent to it. And you'll notice, like, if you don't shower for a couple days, you're like,
Yeah.
okay, it's feeling like swampy down there, right?
Mhm.
When you rinse, you can just rinse with water. You don't even need to have anything extra. But if you do want to use a vulva wash, which vulva is external, not internal,
Mhm.
you should use something specifically for the vulva, but it should not be scented, tingling, burning, glittery. Like the less ingredients, the better, to be
Okay.
honest. But
Yeah.
it should be specifically for the vulva to help maintain pH balance, and you don't need to use anything internally.
Mhm.
The vagina itself, which is the canal from the vulva to the cervix, is self cleaning. So like you don't need to douche or put anything internally. But every scented wash that is on the market specifically for the vulva should be taken off because it's not necessary. Like, when did our vulvas need to smell like coconuts? Like, never.
I think that that's how my brain was trained.
No. I mean, but this is the thing, we were told that, like, we were brought up in an era where, and
Yeah.
still to this day, that, like, it's gross. Like our
Yeah.
vulva and vagina is gross and it's smelly and it's dirty.
Mhm.
And I'm actually like, it's kind of normal. Like it's functioning. It's supposed to ward off bacteria. It's like we have hair to like prevent friction and rubbing and to protect the layers. Like we have moisture to ward off bacteria. Like it's everything in our bodies kind of is there for a reason. And a
Mhm.
light scent is normal, you know, but
Mhm.
it's not, again, if it feels foul, then I would look at like, what are you eating? Is there an infection? Like look at kind of different things, but it shouldn't, it doesn't need to smell like summery and fresh.
No coconuts.
Yeah. And I love fresh. I mean, I know that's why I'm like, it's okay to use a wash if it's a specific vulva wash, but we
Yeah.
don't need like a pina colada
Not a
down
Mexican
there.
party down there.
No, no, no.
Is there a certain like brand or wash that you recommend?
Oh my
I feel
gosh,
like
there's
you
so
need
many
to make
amazing ones
one.
now. No, I work with so many brands and there's so many amazing ones now. So Medicine Mama has one.
Okay.
They have a vulva balm, which is a moisturizer, which I really love. And then they have a vulva wash, which is also excellent. Diva, which has menstrual cups. They're known for the menstrual cups.
Okay,
They came
yeah.
out with like a vulva care line. They have a wash as well, and a moisturizer. Kindra has a moisturizer. Stripes is a new kind of perimenopausal, menopausal brand. They have a moisturizer and a lubricant as well. So, you've got like some pretty awesome options now, which is
Yeah.
great.
I like that you're normalizing it too because, well, now there's like, they're all into like the Vagisil or they're like, just water.
Yeah.
I'm like,
No, I mean,
well, you want a little something, something.
I think we need to meet people where they are. And that's why I was
Yeah.
always like, just water, just water. But then I'm like, people want more. And so I'm really glad
Mhm.
that some brands have come up with options for women who it is pH balanced and it is not overly harsh or,
Yeah.
full of harsh chemicals that feel safe, but it's also like unscented. They're not
Yeah.
like saying that it should smell like a summer's breeze.
Mm-hmm. It's not your Febreze after you do number two. um, Moisturizers.
Yeah.
What's like why?
Well, so, certain times in our life, we have, again, lower estrogen levels, and
Okay.
there can be
Yeah.
dryness in the vulva and vagina that can cause
Okay.
itching, sensitivity, and also pain with sex
Mm-hmm.
because you have less lubrication in the area. So, um, if you're on hormonal birth control that has estrogen in it, like birth control pill or something like that, what happens is that estrogen is kind of you stop making your own your own estrogen because you've got the synthetic estrogen. When you have again less estrogen in your body, your vulva and vagina get drier, thinner, kind of weaker
Mm-hmm.
because there's just less estrogen in the area. So hormonal birth control when you're postpartum and you're lactating or breastfeeding, when you're perimenopausal, and then even certain times in your menstrual cycle when your estrogen levels are lower, so kind of before your period, you have more vaginal dryness and vulvar dryness. So a moisturizer is just like we have like I have like an 8-step skincare routine, and I've got one for the morning and one for after the shower and then one for the PM. And like, what do we do for our vulvas? Like nothing.
True.
And so we don't even know what to do. So we're putting like Vaseline and petroleum jelly on it. And I'm like, you cannot do that. So these are all natural, or not, some are all natural, some are specific pH balance balms, but they're kind of cleaner pH balance moisturizers specifically
Mm-hmm.
for the vulva. They're all external. You can put a little bit at the opening of the vagina, but nothing again really internal. But they just kind of help moisturize and lubricate the tissues to manage dryness.
Hey, I love that. No douching. No?
No,
Okay.
no, no.
Can't
And
say I ever have, but it's been talked about a lot.
it has. And, in some cultural practices, it's common to do after birth. It's common to do
Okay.
after your cycle,
Mm-hmm.
before sex, after sex. So there is some cultural kind of normalcy to it. But I think it's always just important to let people know that it disrupts that vaginal
Mm-hmm.
microbiome. And that puts you at a higher risk for infection because you're changing the pH balance and the microbiome of the vagina. So you don't need to douche at all.
Okay.
At all. And you're actually introducing, like, oftentimes it's bleach or harsh chemicals that people are inserting in there. And so it's just not something that's beneficial for you long term or necessary.
Mm-hmm. What about this whole yoni steam trend? Do you know about it? Your face, you know.
I know about it and I wrote about it and I just posted about it on my Instagram feed and got so much heat. And I'm like, listen, not everyone is going to agree with what I say, but I'm
No.
just going to put the research and my own clinical practice tips out there, and it is up for folks to make their own choices.
Mm-hmm.
So, yoni steaming and V steaming, it's the practice is sitting over a pot of water that sometimes has herbs in it. And you sit kind of undressed and you have a blanket or something kind of wrapped around you. So there's like steam. The thought is that there's steam going kind of, it could be into the uterus, into the womb, into the vulva and vagina. It could be cleansing. It could be help with fertility. There is no research to support that that's the effects that it has. It can
Mm-hmm.
cause some pelvic floor relaxation. It may help with moisture in the area, but what I would say is it's not going to kind of give your vagina magical powers. It's not going to change your fertility. And so I think we need to
Mm-hmm.
be realistic about like what the benefits are. It is something that in a lot of cultural practices is done postpartum. So it's not harmful except if it's too hot. There was a case study
Mm-hmm.
where a woman sat over a pot of water and she actually got a like grade 2 burn on her vulva because these tissues are super sensitive and burned her skin, her tissue in her vulva and vagina and prolapse because of the hot steam. And the other thing is like the steam is only getting external to the vulva. It's not going in your vagina. It's not going up into your womb or your uterus. So you just kind of have to be realistic about what's happening. And a lot of the cultures that utilize this, some of them are Asian cultures, it's done in practice with other rituals that help support women postpartum, which is massage and soothing foods and like kind of mothering the mother and then also doing this steaming. So it's a whole kind of cultural practice. And I think we kind of just like cherry picked one act, piece of the practices and we're like, this is it. So it can be slightly harmful if it's too hot, but
Mm-hmm.
again, just be realistic about what some of the benefits are, much more for relaxation and things like that than it will be like fertility or womb cleansing.
Mm-hmm.
And not everybody's
Yeah.
going to agree with me, but I'm just going to
Mhm.
put it
You gotta
out
say
there.
your piece. You said it. Which I can appreciate because yeah, that would be my biggest fear is burning the bits.
It's sensitive down there. It's sensitive. And yes. And especially if you have prolapse, it's like those are exposed mucosal tissues. So mucosal tissue is like what's on the inside of your mouth, on the inside of your vagina. I mean, it's highly sensitive. So like,
Mm-hmm.
just be cautious is all I recommend.
But yeah, you even think when you eat like a hot food and
Exactly.
doesn't take much.
Yeah.
Oh my god. I'm really into like this whole gut health era of my life and like foods and
Oh, tell me
can
more. This is
I
interesting.
know and candida and bacteria and all these things. So I'm chronically constipated. And I just like, I'm a sore tummy girly for sure. And so I've really cut back to like an anti inflammatory diet. So it's like berries, vegetables, still your protein, your greens, like all of nuts, those kind of things. And in my head, I'm like working it out. I'm like, how, and then you said, depending what foods you're eating too, how does that all play a part in the smell and the presentation and,
Yeah.
all of that.
I think that some people have reported that if they eat certain foods, it feels like smellier in their vagina.
Yeah.
But what I would say is you need to worry more about like inflammation. So high
Mhm.
sugar, high yeast. If you're gluten sensitive, it can just cause like inflammation in your body. And if you already have a vulva and vagina that is susceptible to irritation or infection, whether it be a yeast infection or bacterial infection, I would kind of do exactly what you're doing and kind of pull back and do what we call like elimination diets
Yeah.
and like pull back on the sugars, the anti-inflammatories, the alcohol, wheat, things like that, and then start kind of slowly introducing them one by one to see like what your factors are. But
Mhm.
I mean, I don't know the research to be honest about like sugar and yeast infections, but if I have someone who's coming in with chronic infections, and they've been on antibiotics and then antifungals, like this kind of vicious cycle. It's like, okay, let's like see what in a lifestyle perspective we can change. And we go over everything from like, what underwear are you wearing? Like, what are you
Mhm.
washing with? What clothes are you wearing? Are they breathable? Are you changing after workouts? What lubes are you using? What are you drinking and eating? I think it's like we want to look holistically to be like, what small changes can we make to see if they have a big impact?
Mhm. This hoo-ha underwear, do you know it?
I'm familiar with it. Yeah.
Is it worth it? Like, what underwear are we wearing? I feel like,
I know. It's like this is where the fire
help a
hose of
girl out.
information. I think again, it's one of those things like if you don't have problems, like you are fine. But if you do
Mhm.
have sensitivity, or so I have a lot of patients who can't even wear underwear because of vulvar pain and sensitivity. So it's
Oh.
like we'll start with something more breathable, organic cotton, things that kind of really will help breathe and be really comforting on their tissues versus like non-breathable and irritating.
Mhm.
So I think that for most people they're fine, but I do think it's good to have options. So like bamboo, cotton, organic cottons, low chemical. Like I think it's okay to look at what you're putting next to your body.
Mhm.
Do Most of the time I tell people like if you have sensitivity, like just don't wear underwear at night.
Mhm.
Like just let it breathe. And then during the day, if you have to wear underwear, like I probably wouldn't wear a thong and I would wear something that is a breathable cotton, bamboo, or organic cotton. Um, that just kind of feels like it's more comfortable for your body versus kind of trapping in air, bacteria, heat, things like that.
Mhm. I think I'm gonna jump around a little bit more again. In terms of the comfortability of going to a pelvic floor therapist because of smell or looks. What and I do Brazilians for a living, aside many other things. And everyone and like I make you wear the underwear, but everyone's like, "Oh my gosh, like so embarrassing." You're like, that kind of thing. And I always joke, I'm like, "Ah, you seen one, you seen them all." But truthfully, they all are different. So how are we approaching that? How are we normalizing that in this space?
Yeah, I think there's two things. So, one, definitely try to be with a practitioner you feel comfortable with. And you
Yeah.
kind of know that just by talking with them. Like, do I
Mhm.
feel comfortable with this person? Do I feel like I can be vulnerable? Is it a private treatment room? It shouldn't be in the middle of a gym or loud or anything like that. Like, you should feel comfortable and vulnerable, and like being vulnerable is normal. The
Mhm.
second thing is your therapist should tell you exactly what they're doing and you have consent about whether you approve or not or want to move
Mhm.
forward. So, like today I saw a patient, I said, okay, I'm going to step out, you're going to put the sheet on, this is what we're going to do. I'm going to start externally, then we're going to work internally. And I said, one, if at any point you don't want to do this, like just tell me. Two, does
Mhm.
this feel like an okay plan for you today? And yes. And so even as I'm doing, I'm like, okay, I'm going to pull the sheet back here. This is what I'm going to do before I do it. And then
Mhm.
I again ask for consent. They're still in a really vulnerable position. And then sometimes I just have patients that are like, I'm not up for it today, or I'm on my period, which to be honest, you can go to pelvic floor therapy in your period. It's totally fine. But so it's always working with their comfort levels. You can have a person in the room. You can not have a person, whatever you want. So I think that that's important. The other thing is, can I curse?
Yeah.
Like, we don't give a shit how much hair you have, if you
Yeah.
showered, if you anything. Like, I mean, sometimes I've sensed an odor where I'm like, okay, you're telling me that you have some discomfort with sex, that you've been peeing more. I smell an odor. Like, have you gotten cleared for an infection? So, like,
Mhm.
we'll pick up on some of those things sometimes, but normally, like, it's like me knowing like noticing what colored nail polish you wore on your toes. Like, I would
Mhm.
not be able to tell you. Like, I'm looking for like signs of low estrogen, scar tissue, sensitivity, irritation. I'm like thinking about like, what am I feeling with her muscles? How is she responding? Like, is she comfortable? Like, I've assessed this muscle. I'm going to go to this one next. So I'm thinking very kind of clinically versus
Yeah.
like, how much hair does she have on her bikini? Like, it does not matter to me at all. I have seen all walks. It is like not a big deal for me. So I think that that's one thing too. And yeah, we don't care. Like, we're
Mhm.
like, it's a very medical thing. The last thing, I'm like, this is a body part, like your elbow or your foot or your back. And to us, like, it's just a body part, just like when you go to the OBGYN or the colorectal doc or urologist, like we see this all day, all the time. It is not a big deal. Like, I don't like feet. Like, I would much rather work with somebody's pelvic floor and vulva and vagina than somebody's foot. I'm like, don't put me near a foot. Don't touch your feet on me. Like, I mean, like, I'm not touching your foot. But like, vulva and vaginas and pelvic floors, I'm like, I'm here all day. So
Yeah.
it's just a body part.
Fair. And yeah, it's so true. I think we get in our heads about it. It's like all
Of
those
course.
videos you see about hiding your underwear when you go to your OBGYN. It's
And I do that too. I'm like, oh my God, I do this too. And one of the things though I think is, it's not that we're not going to feel private about this part of our body, but I
Mm,
don't think that we need to feel ashamed about this
yeah.
part of our body because it has a function. And I think that we've thought of the pelvic floor as like only the vagina when it's not. It's like
Mhm.
does a ton of stuff for us. And so I think if we can kind of zoom out a little bit and be like, oh, this is the muscle that helps me like support my growing baby or
Mhm.
relax to put in a menstrual product or relax for peeing and pooping or engages when I'm doing core work. I mean, it has so many different functions than just vagina.
Mhm.
And I think we've often think about vaginas like just for sex, but I'm like, no, they're there for menstruation and birth and pelvic floor support and like all of these things. So we just haven't been taught about it. And when we
Yeah.
have been taught, it's been kind of in a very hush hush, kind of embarrassing way. And so, again, what we really want to do is just like normalize the conversation so that if something is going on, we can advocate for ourselves and get appropriate help.
Mhm. Yeah, that's what was I gonna say? like, oh, when we, like menstrual periods aren't always fun. And if you're having painful sex, you're having these things. I don't know if we've necessarily been taught to seek out assistance for that. It's just like, oh, well, say, in after you've had a baby. Oh, well, you've had a baby, so don't know what to tell you.
Yeah. I mean, and
We're
that's
like,
we've been told like,
yeah,
"Oh, this is just your destiny." And I'm like, "That's total bullshit." Like,
yeah,
I've had 2 babies and I don't have those problems because I knew what to do and how to
hmm
care for it. And these things affect our lives in really challenging ways. Like when you're worried about leakage, like you can't focus on anything else. You're
no,
self-conscious. Your brain is consumed with, are my pants wet? Does it smell? Is it going to happen? Does my partner know? Can anybody see it? Where's the bathroom? Like it's consuming. Or
hmm
if you have pain with sex, you're like, I don't want to be intimate. Or maybe I'll just like take one for the team and endure it. I'm like, why? Like it's like putting your hand on a hot burner and being like, oh,
yeah,
this is fine. It hurts, but like I'm just going to do it because I feel obligated. And it's just full stop. Pain is information from our bodies that something's not
hmm
right. And we need to, it's like a toothache, like seek help. There are specialists who do this and we're here for you. And it, every person who has come in to see us, and there's probably been a lot of hesitation and had to have a lot of courage to do it. Like none of them have said, I'm so upset that I did this. All of them
hmm
have said like, I'm so glad I did this and I wish I would have done it sooner.
yeah. It's life changing.
I hope so. I mean, that's what
Yeah,
we hope, you know, and
yeah,
and I just it's interesting because we get all these things about like, you should exercise this many times a week for your mental health. And I'm like, a lot of people can't exercise because they're
hmm
worried about peeing their pants, or they can't
yeah,
run when that used to bring them joy and now they feel stuck, or they're scared that they're going to do something that's going to hurt their bodies. And we're kind of just like not given guidance on how to care for it because our medical system hasn't put these pieces into place for us. And my hope is that, with women kind of asking for it, or, therapists being more vocal about how we can help, that women can really just take care of this body part because we need it to last our whole lives, you know?
hmm Do you find that practitioners are getting better with like referring obstetrical patients?
Some yes and some no.
Yeah. Okay. So
Yeah.
it's a work in progress.
It's a work in progress. I think that some don't understand what we do. Like they haven't been trained, they haven't been
Yeah.
educated. So I think
Yep.
that a lot of for medical providers, I think that there needs to be a shift in like if you're treating somebody with a vagina, which is over 50% of the population, like
Mhm.
you need to know how to screen for pelvic floor disorders and how to refer out for them.
Mhm.
So I don't expect you to know how to do a pelvic floor muscle exam, but I do expect you to screen and have a place to refer them, whether it's an online option, whether it's my book, whether it's an in-person clinic. I think that there does seem to be a little bit of tension between obstetricians and pelvic floor therapy in some areas. And it's a little bit of like, oh, they're teaching you to birth this way or to breathe this way, or
Mhm.
telling you that these options are okay, but they're not. And we don't support that. And it gets in the way. And I think that everybody is ultimately, we all have the same mission, like take the best care of the baby and take the best care of the mom. But I just can't subscribe to having research that supports options for birthing moms that can minimize pelvic floor dysfunction and not utilizing those and still
Yeah.
producing a very healthy baby, but perhaps an even healthier mom,
Mhm. Which often gets lost.
which is
Yeah.
so often lost.
Yeah. Um, Tearing during childbirth, I don't think we touched on this. This was one of the I just checked my list there, one of the other questions is, um, like, how can we I know our bodies kinda just heal. It's what they're good at doing. But post, tearing and stitches, I had a
Yeah.
mom the other day say, like, it was so painful
Yeah.
after.
Yeah. It is very painful. I mean, you have muscles and tissues that have been cut or torn and they're stitched back together and you're given like 800 milligrams of ibuprofen.
Mhm.
I'm like, so it's not, and then you also have to take care of a baby. So, I think that anytime a wound is healing, there's kind of like 3 phases. So the first phase is like get the inflammation down. So anti-inflammatory medication, pain medication, which some pain medications, if it's narcotic or something like that, can cause constipation, which can irritate your tear. So, but the first thing is like take ibuprofen or something if you can. I know sometimes Tylenol is the only option, but for pain management, ice. So you're going to ice 20 minutes on, 20 minutes off for the first 2 to 3 days. That ice is going to help promote healing. It's going to decrease swelling. And a lot of those things are what cause pain in the area. And then you just want to kind of rinse the area with witch hazel or warm water, avoid aggressive wiping, kind of baby the area. And then you can use a lot of these like lidocaine balms or sprays or things like that to kind of numb the area.
Mhm.
If you have to have a bowel movement, which I want everybody to take stool softeners the first couple days to first couple weeks after giving birth, because it's going to keep your poop soft. And again, like support the perineum or hold the vulva up when you are trying to bear down to poop so you don't feel like you're going to pop any stitches in the area. And then compression, like you have kind of compressive underwear or leggings, something that kind of gives you a little bit of support in the area. And even things like sitting on a donut or sitting on a pillow like that has an opening in the middle so that you're not like dragging that tear when you're getting out of your glider or you're, feeding your baby or pumping or something like that. So babying those muscles and tissues for the first couple days and then starting to do some contractions to help bring blood flow to the area to
Mhm.
assist with healing.
Okay. What about long term? Like, it's obviously never stitched up exactly as it
Yeah.
was before. So what does that look like? Because that's also what was like very uncomfortable.
Yeah, so it can feel like something's ripping or tearing or,
Mhm.
like the tissue's stuck. And so I actually recommend doing, just like you do perineal massage pre childbirth, you do it postpartum as well. So once the wound is healed, which is typically after 6 weeks, 6 or 8 weeks, there should be no bleeding, anything like that. And then you kind of insert a finger or a wand or something like that where you just soften the tissue. You kind of like insert your thumb, gently pull down and massage that scar tissue, almost like we massage a C-section scar, but you're doing that for the perineum. And that can soften that scar tissue as it's still remodeling those first couple months and even into the first year. So that tissue gets softer and it's not so tight and restricted. That tightness and restriction can cause pain with sex, but it can also inhibit your ability to strengthen your pelvic floor. It's like it's so tight that you can't contract or relax.
Mhm.
So making sure that those tissues and muscles are soft, and then you're also doing more relaxation work or strengthening work depending on what you need.
Yeah, I luckily never had that, but I mean,
I mean, and over 90%
it's
of
so
moms who
common.
have a
Yeah.
vaginal birth will have it. And sometimes it's a small paper cut, but it's also can be more severe and a little bit less than 10%, the tear goes into their anal opening and their
Yeah.
rectum. And so they are at risk for prolapse or fecal incontinence. And I'm like, these are the moms that need rehab. Like, you should be
Mhm.
going, like, you get physical therapy for a broken pinky, but you tear into your butthole and you get nothing. I mean, like, this just like
SOS.
blows my mind. And like, oh, and by the way, take care of your baby. Like, best of luck.
Yeah.
And I'm like, this is unbelievable to me. And so it's like we have to have therapy for these moms,
Mhm.
like we have to help them care for their bodies. And people say, like, listen to your body. I'm like, postpartum, your body is speaking a different language,
Yeah.
and like we can help interpret like what kind of care you need.
Mhm. Okay, one final thing you mentioned earlier, lube. What kind of appropriate lube should we be using?
So I first want to say that it's totally fine to use a lubricant. And sometimes it has this um, thought that like, oh, I'm not wet enough or I'm not aroused enough, and that's why I need lubrication. But your hormones are changing every month with your cycle. They're changing postpartum, they're changing in perimenopause. So you can experience vaginal dryness just due to hormonal changes. It has nothing to do with arousal. And lubricants that I really love, like again, it should not be tingling, glittery, glowing, smelly, nothing like that. There are a handful of ones that are like on the aisles of drugstores, but I would say most often you can get them online, like your kind of standard ones that are old school. I wouldn't recommend. For water soluble, I love one called Slippery Stuff. I love another one called Good Clean Love that's got like a lot of really good like organic options. I love oil-based lube as well, but you can't use oil-based lubricant with latex condoms because it will break down the condom.
Okay.
So I love Coconut. You can use coconut oil. And then you can have silicone lubricants as well. So silicone is slicker. So if you have a lot of like dryness or want less friction, it just doesn't rinse off as well. So you kind of
Mhm.
need to get into the shower and kind of rinse the area really well so that it doesn't hang out and cause like bacteria to linger in the area. And there's aloe based lube. Like Diva has a new aloe based lube that I love a lot. So you've got options, but
Mhm.
again, you might have to kind of test some of them. Like some of them are a little burny for me. Some of them I'm like, oh, this is great. Some of them are like too slick.
Yeah.
So you've got options. There's even CBD lubes that can like help the area and kind of just relax a little bit. So you've got a lot of great options and just kind of most of them you can get some samples or especially from a pelvic floor therapist. So,
Mhm.
just check out different ones and see what works for you. But most of them you find in a drugstore are not ideal.
Okay, that's really good to know because there's all sorts of shiny bottles up there.
I know. And like it don't and also know that like it's really normal to have to use them. Very normal.
Mhm. Yeah, I think that's kind of a shame thing too sometimes even it's like, "No, is it not working the way it's supposed to?"
Well, and things change. And again, our hormones
Yes.
change. So we're just
Yeah.
kind of working with our bodies. And again, if it's causing you pain or discomfort or making you not want to have sex, like a small adjustment can go a long way.
Mhm. Well, thank you so much. This was amazing. And I know that a ton of moms are going to want to know where to find you. So, where do
Um,
they do that?
Thanks for having me. So I'm on Instagram as the Vagina Whisperer, so the.vagina.whisperer, and I've got just tons of information on there for every life stage and pelvic floor health. And then I'm on TikTok as the Vag Whisperer because TikTok doesn't like the word vagina. So, and
Oh,
then
shocker.
and then my website is thevaginawhisperer.com. You can order my book on there. And everybody who pre-orders, if this is depends on when this comes out, get 30
Mhm.
days of free pelvic floor workouts. And I have a whole pelvic floor fitness platform for pregnancy and postpartum and childbirth prep, and really just helping women kind of navigate the pelvic floor changes that, we're not told about or we don't even know that we need. And so really helping kind of empower moms to better understand their body and get the strengthening or relaxation they need.
Amazing. Well, I so look forward to reading this book and soaking in all of the information that you share on your page. It's phenomenal. So, thank you for all the work you're doing.
Thanks for having me.
Of course.